office in Oakland. It's a pleasure to have you all here today. And without further ado, it's my pleasure to introduce Sonia Tetnowski, who is the CEO of Indian Health Center of Santa Clara Valley.
Good morning. Iikwinuk, Sisikwa, Hayuk Kwala. Good morning. I'm honored to be here with you today. I am Hikwala, she who walks with the ancestors, also known as Sonia Tetnowski, a Makah tribal member and CEO of the Indian Health Center of Santa Clara Valley. Today I'm happy to welcome the Covered California bus to San Jose. We're very excited to have them here with us. The Indian Health Center has been serving this community for over 41 years. And we've been a proud partner of Covered California since it started enrollment in 2013. Together, we've helped serve over 25,000 patients in this community. And it's our honor today to continue to support our community and work diligently to get the health care that they need at this time. Through this partnership, we've built a healthier community for everyone. Because when families are insured, children are healthier, happier, and do better in school. As the children are our investment in the future, the stronger and healthier they are, the stronger our community becomes. When their parents are insured, they know they have a peace of mind that they are covered without fear of financial burden and hardship. When individuals are insured, they can better pursue their careers and their passions without fear of getting sick or injured in their journey. And when our state takes a leadership role in providing health coverage for our citizens, we are once again leading the way for the nation. I am proud to be a partner with Covered California and look forward to many more years of serving our community. So with that, I would once again like to welcome to our community Covered California. Please join me in giving a warm San Jose welcome to Covered California's Executive Director, Peter V. Lee. Welcome.
Sonia, thank you so much for the welcome. It's great to be back here in San Jose and to be part of the very kickoff of our open enrollment tour. Before going into our remarks about why we're here, I want to take a moment to acknowledge what's happening around California. First, we continue to see news reports of the loss of life and the people injured in the horrific shooting in Thousand Oaks. And I want to take a moment to acknowledge the impacts on the fires, both in Ventura County and in Butte County. It's touching the lives of thousands and thousands of people, and we are directly affected by having moved inside to use the air quality that's touching people around the Bay Area. Covered California talks a lot about being woven into communities across California. These issues that are touching communities are touching all of us. So thank you for keeping those communities in your thoughts as we go forward. So open enrollment for Covered California is a very big deal. We're kicking off the 6th open enrollment period now throughout California with a statewide bus tour. We're going to be stopping in 23 locations. We're going to be stopping and visiting insurance agents, community clinics, groups like the Indian Health Center. And we're bringing it home because in the end, there's a lot of national and state issues, but healthcare is local. Here in San Jose, we have community groups, insurance agents that are making the difference in people's lives. In a few minutes, you're going to have that local story brought home by Syndicate, a San Jose dance crew. Because one of the things we're doing is bringing the story of health coverage and how life can change in an instant to life through dance. So stay tuned for that. We're excited by it and having that be a local story. Before the local story, though, I want to talk a little bit about the elections that just happened. So we had major elections earlier this week. And a couple things that I won't talk about is pollsters and politicians, what does it all mean? I do want to talk briefly about what it means for healthcare, both in California and the nation. And the first thing it means is that now the Affordable Care Act is irrevocably woven into the fabric of America. There is no going back. Not only did we see the House of Representatives turn Democrat on an issue that was about health care, but more importantly than this being a red or blue issue, we saw 3 very red states, Idaho, Missouri, and Utah, vote to expand Medicaid. Those states are joining California, but they aren't just joining California. They're joining 33 other states, the majority of which have Republican governors saying expanding coverage is the right thing to do. We saw in this election people across the political spectrum basically say that the Affordable Care Act's tools are essential. Making sure people with pre-existing conditions are not denied coverage. Making sure people get a leg up financially to help them when they need financial help. This is a turning point because we now, in California, with a new governor taking office soon, Gavin Newsom, are going to keep doing what we've been doing, which is focus on consumers, but also building on what we've done. Still in California, healthcare can be too expensive for too many people. We have a platform with the Affordable Care Act and a commitment in this state to build on what we've already done, which is approaching universal coverage, to go further and reach out to more Californians. Part of doing that outreach is working with legislators and legislative offices. I want to acknowledge and appreciate representatives of Senator Bell and Assemblymember Calra who are here with us today. Thank you very much. When we work in communities, we work very often with legislative leaders to make sure not only do things happen in Sacramento, but things happen here in San Jose, that people get the word out about open enrollment. So thank you for joining us today. So we're hitting the road because the Affordable Care Act is the law of the land. It supports the Medi-Cal expansion. It supports the tax credits that mean more than 1 million people in covered California get financial help. But we know that we're not done. Here in California, over 1 million of our neighbors do not have insurance, and they're eligible for either Medi-Cal or Covered California. Here in the Greater Bay Area, over 120,000 people. What we're doing today is working to get the word out. We don't want to leave anyone behind. Now, many of you will be seeing in the days and weeks ahead ads on TV, on radio. You'll be seeing those and hearing those ads, not just in English, but in Spanish, in Vietnamese, in Chinese, in Korean. We're getting the word out because we found, unfortunately, that 4 out of 5 of the people eligible for financial help don't realize it. 4 out of 5. Now, everyone at this point knows Covered California's name. We've got great brand recognition. That doesn't matter. Health care is about being affordable. Making it affordable is something we need to get the word out about. And if people are going to get sick, we want to make sure they get sick when they have coverage. We want to make sure that consumers know that the Affordable Care Act supports not only people who are lower income, but you can get a subsidy if you make up to $48,000 as an individual, $100,000 a family of 4. Everyone needs a leg up to make healthcare affordable, and people can find out in an instant at coveredca.com if they're eligible for financial help. So why is this important? It's a dollars and cents issue. We make the affordability real. For many people, they're spending less than $50 a month for coverage. But why get that coverage? Life really can change in an instant. Now you'll see that demonstrated in dance in a moment. But I'm sort of a numbers guy. That's why I'm not going to do the dancing. So let me tell you some of the numbers. First, for people in Covered California, we had 1 out of 10 had health events last year that cost over $5,000. 15,000 healthcare costs of over $50,000. Some millions of dollars. But think about those people. Last year, over 20,000 of people that we insured broke an arm or dislocated a shoulder. 20,000. Broken arm. Over 50,000 of people in Covered California last year were either diagnosed with or living with a cancer diagnosis. Cancer diagnosis. Now, I got to tell you, not one of those people went into last year thinking, I think this is the year I'll break my arm. I think this is the year I'm going to get cancer. Health insurance is about being there for the things you don't plan for. It's about being there for the unexpected. That's why our theme for this tour is Life Can Change in an Instant. Yes, we want people to make sure insurance is there so they don't walk out of a hospital with a $50,000 debt. But more importantly, we want people to have health insurance so they get the right care at the right time, so they stay healthy. So if they do get cancer, they get the best possible care and treatment. That's vital, and that's what we're about. So I talk about numbers, but behind those numbers are real people whose lives have been affected and changed. Now, since we've opened our doors in 2014, more than 5 million Californians have had coverage directly with Covered California or with the plans that we sponsor and support in the individual market. That's 1 out of 6 Californians. 1 out of 6 Californians under 65. That's a lot. Now, that's because people change. People come to us, and then they get employer-based coverage. Hallelujah. But behind those numbers are real people. And I'm so thrilled today to have one of those people with us today, Rosalinda Nunez. She understands that life can change in an instant. She's been enrolled with us since 2014. At first, she was worried it was too expensive, but she was surprised at how affordable it can be. And I'd like to turn it over now to Rosalinda to say a few words, and also with our own Irina Malara, who will translate. Rosalinda, can you say a few words?
Buenos días. Muy buenos días. Mi nombre es Rosalinda Núñez. Gracias por la invitación.
Good morning, my name is Rosalinda Núñez. Thank you for the invitation.
Yo vivo en San José. Yo tengo cobertura médica desde el 2014.
I live in San Jose. I have health coverage since 2014.
La razón porque fue obligatorio.
I got health insurance because it was the mandate.
De hecho, con el tiempo me fui dando cuenta que...
But soon I noticed that it was helpful.
Los beneficios de Cover California, porque yo, en lo personal,
the benefits of Cover California are great, and
yo en lo personal, para mí era muy difícil obtener un seguro médico porque es muy caro.
I thought it was too expensive, and I thought I couldn't afford to have health insurance.
De hecho, descubrí todos los beneficios para mí y para mi familia, que estuve sin preocupaciones, sin tener la preocupación de enfermarme.
The thing that I value the most for me and my family is it's to have peace of mind and not have to worry about it.
Yo le recomiendo a la gente, por favor, apliquen para Cover California.
I would recommend everybody to find out how affordable it is.
Es una excelente aseguranza médica. De hecho, a mí en lo personal,
it's an excellent. It has excellent benefits. Cover California has excellent benefits.
Para mí, mi cobertura que yo tengo en este momento me cubre un 80% con un precio muy bajo de $56 al mes.
My health insurance covers 80% of everything, and I pay $56 a month.
Yo de hecho estoy sin preocupaciones. Muchas gracias a Cover California.
I have peace of mind. Thank you, Cover California.
Rosalinda, muchas gracias. Thank you so much. Now, some people spend less than $56 a month, some spend more, but they all have peace of mind. And we know that consumers need help. And one of the things I'd like to see, if you're an insurance agent and enroller, can you raise your hand? You've been with us today helping people enroll. Can we give a round of applause for these folks who are helping people enroll? California has signed up millions of people, half of them through certified insurance agents and also through our enrollers. And you can find them by going to coveredca.com. Put in your zip code. Find people in your community. We have, I like to say we have insurance agents that speak Spanish, they speak Vietnamese, they speak Chinese, they speak Korean, but they all speak insurance. And insurance can be confusing. Getting help matters. You can also, besides visiting our website, call our 800 number at 800-300-1506. We can connect you with people who can help you. So this is real. Every year we need to get the word out. Now, we're getting the word out this year in a somewhat different way. Last year, we sponsored murals. We have one here in San Jose in a Vietnamese shopping center. It's a beautiful mural. It's there today. It's going to be there for years to come. It's demonstrating that we're woven into the local communities here in San Jose. Well, this year, we're seeking to tell our story through dance. Well, I'm not going to dance. Okay, that's the good news for all of you. But why dance? Well, one, millions of Californians stay healthy through dance. Whether it's Zumba, jazz, hip-hop, dance is universal. Dance also captures the incredible diversity of our state. California is one of the diverse states in the nation. Culturally, ethnically, dance reflects that. But also, we know that healthcare is complicated, and we need to communicate in different ways. Some people, you speak to their head. You give them numbers. You talk about 50,000 people with cancer. You talk about $56. Others, you speak to their heart. Dance talks to the heart. It conveys a message through image that we think will communicate strongly with people that maybe you don't speak to the head with. So I'm now going to ask, the Syndicate Dance Group is from right here in San Jose. They're going to present a performance inspired by the busy holiday shopping season. So think shoppers coming. If you think ugly sweaters, you might get the point when you see them dancing for the holiday season. And I'm going to take this as I move off the stage. We're now going to have the folks clear the stage. We step to the sides here because we're going to have the dance crew come up. I would encourage you, though, to get out your phones. Because one of the reasons we're doing dance is we are increasingly a digital age. So we had covered California. We do advertising on Pandora, everything. Sorry we're going to interrupt you a lot in the coming years. But that's because we live in a digital world. Take a video of this. Share it with your friends, with your family, with your neighbors. This is going to be engaging. You getting the word out is partly also what we want to engage. So with that, ladies and gentlemen, the Syndicate.
If I take you down, would you really hold me down and be your best friend? She just wanna hit me with a quickie by the phone and I'm like, yes, man. But you got me feeling for your body, you might turn me to a yes, man. Oh yeah. 80 and a 40, I'm a nervous bitch, I'm flyer than your ex, man. We ain't gotta go outside. Two-step, wake up by my side. Don't care what you say. Oh, you just my type. Oh, yeah, she know the deal like an old script. You ain't the first to really sell that shit. Champagne with the roof gun. Bought this jam back in Tucson. Think I got to get a move on. Never had much to lose, but you could do better with me in the middle of the road, the back of the Jeep. So baby, let's not talk about it. But I gotta know, if I take you down, would you really hold me down and be your best friend? She just wanna hit me with a quickie by the phone and I'm like, yes, man. But you got me feeling for your body, you might turn me to a yes, man. Oh yeah. 80 and a 40, I'm a nervous bitch, I'm flyer than your ex, man. Why you act so extra? Let me in your section. Running through my mind, we got a connection. Back home ain't the same, your pop's drinking all the time. You just wanna get away, come hop up in my ride. Two goofies on the run, couple 40s in the backseat. Spirits in my lungs, got my voice a little raspy. Turn me to a yes, man. Before we do this, girl, I got a question.
Give it up to the syndicate. Thank you very much. You guys rock. So, even holiday season, accidents can happen. Share this at hashtag in an instant, hashtag covered CA and dance. We want to encourage all of you to get the word out. We also want to encourage all of you to join us in one of our holiday traditions, not holiday traditions, one of our open enrollment traditions, which is to join us out by the bus with the syndicate dance crew and all of you to have a San Jose group picture. So we'd like you now to join us by the bus. We're going to have a group picture for San Jose